We realized that there were a lot of people who had offered care in the aftermath of the marathon bombings who were suffering.
The marathon really took it up to an extraordinary level. I think part of the dynamic there was that was as much about our healing as the healing of the patients in those cases. And I think that those extraordinary efforts were reflecting our staff's need to heal.
The Schwartz Rounds are an international program that are designed to bring people together. Anyone who touches the care of any individual in a given healthcare facility can come together and talk about the emotional impact of caring for patients. The focus is really on caring for the caregivers. We've done 2 sets of rounds after the marathon bombings occurred. The first set was 6 months after the events, and then the second was before the second marathon was to be run. We knew that many people would be experiencing what we call anniversary reactions, a re-triggering of some of the same emotional distress that they experienced right after the marathon. We wanted to sustain their resilience, even in the face of those anniversary reactions. And people recounted those experiences. These memories are just seared in their hearts and in their minds. More and more organizations are reaching out to us in the aftermath of such community trauma to be of help. So the Schwartz Center is bringing together representatives from some of the hospitals that have experienced this kind of trauma and tragedy to be our peer advisors, our coaches, our experts. So we'll be creating a package of resources that we can offer to others. One of the most important things that can sustain resilience in times of almost unbearable stress is support and a sense of being connected with a community. The Schwartz Rounds provides that kind of support.
And the Schwartz Rounds, for me, they were really important to know that, yes, something really bad happened out there for really bad reasons, but there was a team of people in here helping each other, helping one another, regardless of who was coming in and who wasn't.
What we needed was a time to pause and just be with this, to be with the feelings, to be with the injustice, to be with the rawness of this. And that's very much what we did at the Schwartz Center Round. We just stopped. We just stopped and told the story, and we dropped from the head and from analysis and from solutions to the heart of what does this feel like? What did this invoke in me? Who are we as a people in our response to this? How do we respond compassionately? You can't prepare your heart for something like this. And the response of the heart, the response of the injustice of this, nobody was ready for that.
We are here as a group, as an extended family, to talk about how this is affecting all of us. There were a lot of tears. There's a lot of bonding that took place that may not otherwise have happened.
Well, I don't think you can bottle things up for too long until it takes its toll, either personally, in terms of stress level, burnout. It can make you edgy.
I think Schwartz Rounds is all the more needed, not just here, but everywhere, in order to be able to provide that kind of support to staff.
As professionals, we're taught to hide our feelings, certainly to hide them and to set them aside, with the priority being take care of the patient or the family in front of you.
But as surgeons, we are bred tough. That's part of the persona, that's part of what is necessary. We do pretty difficult things on a routine basis, and to prepare yourself for that, you can often put up a bit of a veneer that says, I'm Teflon, this doesn't get to me. It's not true.
The natural inclination when we have all of these feelings is often to begin to distance ourselves from it. It's draining, it's hard, it's exhausting kind of work. And if you don't have some mechanism for helping people to recharge, to acknowledge and to talk about some of these things, they're going to distance themselves from that, and in doing so are going to distance themselves from the patients.
Unfortunately, I don't think that this kind of tragedy is going to cease anytime soon. We want to be ready to help people who seek our help.